Hello, I have got the lovely Sheila Dome with me. I've dragged her out of the camper van and off the back of the motorbike. Team, I wanted to chat to Sheila because I didn't get it. Sheila's doing a session at Celebration called To Roll
Or not to
or
roll.
Not to Roll. It was the great Julianne that asked me a question about the controversy that's going around about whether we should foam roller or not. And Julianne asked me and I went, I've got absolutely no idea, but I know a woman who does. So I'm going to pass it over to Sheila because we've just been sat chatting. And what I did want to know with Sheila is, what is the controversy? Why was it at one point everybody was foam rolling? Everything was about, we've done workshops on foam rolling. What's the difference now? What's sort of the question that's coming up about it?
Well, it's the fact that tissue's different. How many different types of tissue do we have in the body? Soft tissue. We have muscles, we have tendons, we have ligaments, we have fascia. And fascia encases everything. When you are working on what we call trigger points, they are muscle knots. So muscle knots are what we basically call energy crisis. It means the blood supply is not getting in because the fibres have locked in place. Okay. So it becomes quite acidic.
Right.
So the idea of trigger point is we press into that spot and it does a couple of different things. One idea is that it pushes all the acidity out into surrounding tissues. Two is that it blocks the nerve sensation, a bit like if you banged your knee when you were a kid, your mum would rub you, and that confuses the nerve signal, so it distracts the pain stimulus that you're getting.
I didn't know that.
And then thirdly is that when you release it, blood floods back into that area, and now you've got oxygenated blood going into that area.
I get it.
With fascia is a completely different structure, and we have lots and lots of proprioceptors, far more proprioceptors within the fascia system than anywhere else. So it becomes hypersensitive. And I'm going to give the example of, which is one of the most controversial one, is the IT band. With the IT band, everybody used to roll up and down it. I've got runner's knee,
roll up and down.
and it's absolute agony. And I've done it, and I do it again later, and it's still as painful. Why is it not going? Because it's not a muscle knot. It's not a trigger point. What you have got is that the reaction from the IT band is to stabilise around the hip and the knee, and also the alignment of the ankle. So if there's dysfunction ankle, knee or hip, the IT band ends up working harder. You have your fascia that it connects through. You've got a problem with the TFL, you've got a problem with the glute med, you've got a problem with the glute max, if that's not firing. If you've got a problem with the vastus lateralis that actually sits side to side, if that is tighter, so the knee alignment down to the fact that you pronate or supinate affects the knee, affects the hip, the IT band will be affected and things will start to work incorrectly. So when you're rolling on it, you're not releasing it because it is a fibrous tissue. It doesn't have the elasticity that a muscle fibre does. When we're stretching a muscle, we're increasing what we call sarcomeres along that length to make the muscle longer, but it is over a period of time. You can't increase that. What you need to do is to look at the function of the hip, the pelvis, the knee and the ankle. So it's using a different method, because what we do want to do is for fascia to be able to slide and glide. The fascia, although it's attached to these, originates in this area from different muscles and the bone, and it goes down and attaches to the outside of the tibia. It also connects into the bone fascia of the femur. And it does need to move and slide and glide.
So you wouldn't not do it then?
I wouldn't do it the way we do it. So the fascia loves movement. You need to separate. First of all, you need to make a function. Make it, your pelvis functional, your knee functional, your ankle. Then that won't react. The IT band won't react.
Yes.
Then we rehydrate it, and it's how we rehydrate it is the important thing.
I get that. So we're not saying don't use foam rollering.
It's the method and what you're using it for.
And I know, Sheila, you talked about this, and I know Tracy talks about it in Hog too. If we are doing a lot of fascial release, whether it's spiky ball, foam roller, pulse rolls, whatever it is, whatever method we're doing, we do need to ensure that we stabilise around that area, that we don't just do an hour's spiky ball and then say to people, see you later, that there has to be a bigger picture to it.
Absolutely. And that's exactly as I say, just using the IT band as one element, because there's lots of areas that are fascia that if that becomes tighter around the wrist, around the ankle, that restricts your range of movement. Your ability for your foot to be able to dorsiflex, plantarflex is depending on the soft tissue in respect of not muscles but the tendons, the ligaments, and this fascial band. So you have a bracelet, and you have these bracelets all over the body, and this should move on the structures underneath, and if they don't, they become like as if it's a belt that's tied around it. Yeah,
I get that. And I think, you know, I've used foam roller for a long time, but I've never felt I'm an expert at the foam roller, but I've used it. So coming to your session, without giving the game away, because I don't want Sheila to give the whole game away, but what would you say might be different in your approach at celebration to teaching the foam roller to what we might have done, say, 10 years ago?
The difference was there used to be that philosophy of no pain, no gain.
Yes, yes.
And when with fascia, if you are eliciting pain, you're actually going to get a negative response from the fascia. So it's a different way of thinking, and you're looking at identifying how to get the movement without creating a pain response.
Yes, yes.
And that is basically it. Is you look from head to foot, and we will talk about the item. There's so much more I can blab on about, and I don't.
And I'm not going to let her because she's giving the game away. Something that you said to me before is that you're using a lot more movement rather than rolling. You're using
you tether.
Yes, right.
And
that
then
was it.
move the body.
Right. Yeah. Rather than previously we might have just
roll up and down.
Yeah.
Where you would be screaming and shouting because you're rolling up and down the outside thigh. And you're trying to hold and stabilise your shoulders, so it's not that. You tether and then move.
Right. So that's on the 7th of November, and Sheila is going to be doing the to roll or not to roll, and I'll be in the room, but I will definitely not be letting anybody do anything around any of my nether regions. See you later. Bye from me.
Bye from me.